Hello, welcome to this podcast of Cardiovascular Research Onlife. I'm Harrison Toniadis, Deputy Editor of Cardiovascular Research, and my guest today is Dr. David Harrison from the University of Vanderbilt. He's also a Deputy Editor of Cardiovascular Research. You have just received a very important award from the American Heart Association, that of the Basic Research Prize. How do you feel about this, and how important is this for your career and for you?
Well, it's a tremendous honor, and it's, I think in recognition of work that I've done throughout my career. And as I said in my presentation, the award should really go to the many people that have worked with me in my laboratory for the last 25 years or so. I've just been tremendously lucky to have a number of very smart, highly motivated, hardworking young men and women that have come to my laboratory and participated in my research for the last 2.5 decades or so, and they really should get this award.
Now, apart from a great basic scientist, you are also a practicing clinician. Why do you think the vast majority of basic science fails to translate in clinical practice?
Well, it's a long way from basic findings to translational manifestations of our research. A classic example are the checkpoint inhibitors that are used for cancer. You know, this discovery was made 25 years ago, and only in the last few years have people begun to use checkpoint inhibitors very successfully to treat cancer. And I just think it takes a long, long time. And there's a lot of pitfalls along the way. Things that look promising in the laboratory turn out to not be applicable to clinical practice.
So the results of the CIRT trial have just been presented in the American Heart Association meeting.
Yes.
I told it here. What does this negative result mean for the field of inflammation, and what does this result really mean?
You know, I think it's an illustration of how little we understand about the topic of inflammation. And I think cardiologists and cardiovascular researchers in particular have lumped inflammation into a black box and have made the assumption that inflammation is all the same. And we're now learning, and we have been learning for many years, that inflammation involves many different pathways, and it's one size does not fit all. For example, we know that TNF-alpha antagonists are wonderful for treatment of rheumatoid arthritis, and they don't work at all for psoriasis. Both of these are autoimmune diseases, but they have very different etiologies, very different pathways are involved, and so treatments may not be the same. It's not terribly surprising that an IL-1 beta antagonist worked in the CANTOS trial, but a drug like methotrexate failed in this CIRT trial. And I think it just speaks to the fact that these different drugs are addressing different pathways that may or may not be involved in atherosclerosis.
As a deputy editor of cardiovascular research over the last nearly 1 year, you have been involved in shaping the future and the policies of cardiovascular research. Which are the main strengths that you see from the journal?
Sure. So I've been really impressed with the quality of papers that I've received to review, and the ones that ultimately have been published have been really excellent contributions. You know, I think the history of cardiovascular research was that it was focused on cardiomyocyte biology and perhaps ion channels, and the new editor, Dr. Guzik, has really opened the venue of cardiovascular research to include vascular biology and other aspects of cardiovascular biology that I think are important. So if authors have good papers in fields aside from cardiomyocyte biology, but also in cardiomyocyte biology, cardiovascular research is an excellent journal to submit your work to.
Thank you, Dr. Harrison, for this opportunity to give us this interview today for cardiovascular research. A great honor to interview you.
Thank you very much.